Hello, my name is Tanya Phillips, and I am going to present on the Jackson County Community Health Assessment that was put together for GPH 732. The process that was used for this project is first we selected a community of interest. I chose Jackson County Public Health, and then we selected a community health process model or logic model. For myself, I selected the Mobilizing for Action through Planning and Partnership, which is also known as the MAP. Next, we gathered community data, which included socioeconomic information for the county, also demographic information. Next, we collected community health data. We then identified priority health concerns by analyzing the data that we had gathered from the community data process, but also the community health data. And next in the process, we will distribute the findings. The MAP process for this assignment that we used the most were phase 3 of the assessment. This was really the data collection part of the assignment. So we used secondary data collection, which was majority of it was a quantitative data. Sources that were used were Center for Disease Control, Orpheus, which is an epidemiologist or epidemiology data collection for communicable diseases in Oregon. Jackson County website, Census Bureau, Oregon Health Authority, and county health rankings were some. The primary data collection, or the qualitative data for this assignment, we used the windshield survey and interviews. Windshield survey was done in Track 1, Census Track 1 in Medford, and interviews took place with Oregon State University and also Jackson County Public Health. Data was then assessed using a side-by-side comparison method. We compared Jackson County data to the state of Oregon as a whole, and then Healthy People 2020. Jackson County is located in southern Oregon and is the 6th largest county by population, with a population size of 527,000 people living in Jackson County, and that was for 2016. Majority of the people living in Jackson County do identify as white, but the second largest racial group are the Latino population, representing 12.5% of the population. For those 65 years and older living in the county, represent 21% of the population, and the average age in Jackson County is 42 years of age. About 19% of the population in Jackson County experience living in poverty, with women and children experiencing poverty at higher rates than males. Children in Jackson County have higher rates of living in poverty, as I mentioned, compared to the state as a whole as well. And 25% of the children live in poverty, and this is compared to 20% for the state as a whole. There is about 87,000 employees in Jackson County, which represent 58% of the population, and this is below the average for the state of 62%. An unemployment rate is higher in Jackson County than the state of Oregon at 6.9%. And women earn less than their male counterparts in Jackson County as well. Jackson County was once known for its timber, but the economy has since diversified. Healthcare is one of the top industries, largest employment groups in the county, and the second is retail or manufacturing, and the third largest is government. Marijuana industry is becoming a very popular industry in southern Oregon. Currently, Jackson County has 30% of the marijuana producer license, and combined with Josephine County and neighboring county, they hold together 50% of the producer license for the state, and data shows that between these two counties, majority of the marijuana is produced in southern Oregon. Having a safe community impacts physical and mental health, and Jackson County experiences more violent crimes per 100,000 population than the state. The housing market is very competitive for renters and buyers. Currently, 62% of homeowners live in the home that they purchased. The average rent in Jackson County is $886, which is slightly below the state average. According to Jackson County Housing Authority, there's a 3-year waiting list for those who qualify for housing assistance. And the overall renting availability market is at 1.89%. And I also learned that from Access that it is recommended that 1/3 of someone's income goes to their housing costs. And there are people, and a lot of people in Jackson County, that are paying up to 70% of their income towards housing, which leaves little income for food, electricity, and child care. And currently, looking at the Jackson County health rankings, 24% of the population in the county have experienced severe housing problems. This includes overcrowding, housing costs, and lack of kitchen or plumbing facilities. Jackson County ranks 15 in the state for its clinical services according to the county health rankings. Since the Affordable Care Act, Jackson County has improved the percentage of the population that has health care insurance. Jackson County ranks 24th in the state for health behavior, and in the county, 11th graders for Jackson County have a higher 30-day use for tobacco, marijuana, and prescription pill use, and this is compared to the state average. Jackson County also has a higher rate of adults that smoke cigarettes regularly at 20% compared to 19% for the state, and they also have a higher percentage of mothers smoking during pregnancy. Over the years, despite seeing teen pregnancies among all youth decrease, there's still a disparity between non-Latino and Latino population. White youth ages 15 to 19 years of age had 21 pregnancies per 1,000 population, and this was compared to our Latino youth at 51 pregnancies per population. Sexually transmitted infections are quickly becoming a public health crisis in Jackson County. The incidence of gonorrhea, syphilis, and chlamydia have all been increasing at a steady rate over the past years, and this is the priority health concern for the county that I chose, and I'll go in more detail later. Jackson County ranks 24th in the state on social and economic factors, and I want to highlight the graduation rates. In 2017, Jackson County had a high school graduation rate of 75%, which is below the Healthy People 2020 goal. What is even more alarming, though, is that the Latino youth have lower graduation rate than the county average at 64%. Suicide rates are alarming in comparison to Healthy People 2020. Jackson County experiences 22.28 lives lost due to suicide per 100,000 population, and Jackson County has an injury rate of 82 deaths per 100,000 population rate. Jackson County also ranks 32 out of 36 for the state on physical environment, and what is highlighted here is that there were 77.6 days where the average air quality daily density of the particulate matter was 2.5. As I mentioned, the priority health issue for Jackson County is their increase in sexually transmitted infections. So looking at sexually transmitted infections in the United States and Jackson County have reached all-time highs in 2016. Chlamydia and gonorrhea are the most common and most reported communicable disease in the United States, and this is the same for Jackson County. And sexually transmitted infections can lead to further complications, can be transmitted to infants during pregnancy or at birth, and can facilitate the transmission of the HIV infection. Looking at the data, as mentioned, chlamydia increased 8% from 2015 to 2016. Majority of the cases are females, and ages range with 80% being in their teens or 20s. Gonorrhea increased 84%, predominantly male cases with 52%, and overall 79% of the cases were in their 20s or 30s. Syphilis rose 38%, with 75% of the cases being male or men who have sex with men is a risk category for syphilis. Majority of the syphilis cases were males, again, as I mentioned, but ages 30 to 60 years of age, so a little on the older side. And there is an increase in female cases, which is always a concern because of this will lead often leads to an increase in congenital syphilis. Risk factors include unprotected vaginal, anal, and/or oral sexual intercourse. The number of sexual partner one has increases the risk for sexually transmitted infections. Men who have sex with men is a risk factor. Illicit drug use. Hookup apps has been noted as a risk factor, but what comes with that is the individual has more sexual partners. And then the lack of public health funding for having resources, outreach education, and then yearly STI testing needs to be done. If someone doesn't have that done or isn't in that habit, also can lead to an increase of sexually transmitted infections. Resources in the county is that currently Jackson County does have sexually transmitted infection clinics. These are located at Jackson County Public Health, Planned Parenthood, La Clinica, and Roe Community Health. There are also grant opportunities available right now, and Jackson County was awarded a grant to address the increase in sexually transmitted infections and end HIV goal. The county receives funding to implement comprehensive and medically accurate sexual health curriculum, and the teaching standards in Oregon as a whole are higher than most states. There's also the Regional Health Equity Coalition, which is a partner of Jackson County Public Health, and they are really there to help identify equity issues around health. And this is, and STIs is one that between the county and the Health Equity Coalition are focusing on. So summary, socioeconomic status is an issue in the county and has room for improvement. Poverty is impacting the health of the community as a whole, and low graduation rates. Health behaviors and health outcomes are still a concern. Looking at tobacco use by adults and tobacco use by women, there's still great room to improve for the county as they have higher rates than the state average. And sexually transmitted infections is that trending topic that continues to increase as the other behaviors are decreasing. Again, chlamydia had an 8% increase, gonorrhea had an 84% increase, and early syphilis 38%. Populations at risk are men who have sex with men. Behaviors are unprotected vaginal, anal, and oral sex, number of sexual partners, men who have sex with men, illicit drug use, and utilization of hookup apps. Risks with public health funding, though the county did just receive funding to assist with this. And that is the end of my presentation. Thank you.